Let's head to Napak, where a visit by the Uganda Country Coordinating Mechanism for Global Fund has reported that tuberculosis is one of the leading causes of mortality in the district. The team is in the district to oversee the implementation of Global Fund grants. Benadiga is in Karamoja and now reports.
Locholo Simon Peter, aged 23, is a resident of Apietolem sub-county in Napak District. He suffers tuberculosis.
I come here because of sickness, this TB.
He came to learn about it 3 weeks ago.
Because I was coughing, I was feeling bad, and my bones was paining.
Simon is among the 253 patients receiving treatment for tuberculosis at St. Kizito Matanyi Hospital in Napak District.
I'm getting drugs, I'm getting injections, some other things like food.
Behind me is the tuberculosis treatment ward here at St. Kizito Matanyi Hospital in Napak District, and we've been told by medical experts here that tuberculosis is one of the leading causes of deaths, especially when it comes to patients that present with signs of tuberculosis and HIV and AIDS.
One of the leading causes of death is TB. Yeah, and the prevalence is really high, and so happens many also die because they come in late stages. Yeah, actually the most death is amongst patients who are co-infected with HIV, TB, HIV. Yeah, when you look at the death rate, most of them are HIV, TB patients. Yeah, though the prevalence of HIV here is not very high. Yeah. It
seems the social-cultural setting of the population and their way of living contribute to the vulnerability.
Yeah, we have something called manyata, like a homestead of very many people living together. So if it is one person who is having TB and these other people around this very patient are likely to have TB.
So that is the reason why as a country, we should focus a lot on community aspect of TB management in terms of treatment support, in terms of follow-up, in terms of contact tracing, to get to the community and ensure that people understand what TB is all about. It's not witchcraft. It's not caught through sharing utensils. It's treatable. It's curable. And so it's all about information at the community level.
The hospital has 2 gene expert machines used for diagnosing tuberculosis, but one is not performing to full capacity, hindering service delivery. Over 70 samples are checked every week.
We can have a little delay because we have only 7 modules running. So the one that is down cuts off the output. So it increases on the waiting time for the patient.
The Chief Executive Officer, St. Kizito Matanyi Hospital, Brother Ganta Narich, is skeptical about the bureaucracy involved in purchasing medical equipment.
How many months no hub right now, the second one? Maybe almost a year now. Huh? And the other fellow has to run around to get a spare for the spare tire or let's say new tires for the thing is a problem. He has to fall 10 times before he gets it because the things are flat now in the rainy season. Huh? Until they say, okay, exception, you buy the tires yourself because our procedures are too long. And I could tell you a lot of stories about all these procedures which take a lot of time and they are not cheaper, they are more expensive at the end.
Brother Ganta interacted with the Uganda Country Coordinating Mechanism for Global Fund. In the country, Global Fund Board visited Napak District to oversee the implementation of programs supported by Global Fund.
We've created connection network between the hospital and the ministries, especially the Ministry of Finance, Ministry of Health, and the conversation has started. But in addition to that, we asked the DHO to work closely also to see how they can be able to support this hospital, which is giving one of the best services, if I can say, to the people.
Founded in 1970, the 250-bed rural hospital in Napak District is among the 33 private not-for-profit hospitals in the country run under the Uganda Catholic Medical Bureau. The team continues its oversight visit in Moroto District before heading to Chiriandongo and Kibale districts. Bernard Higa, UBC TV, Napak District, in Karamoja.